Okay, students, welcome to your class in ethics. So this is foundational ethical concepts and historical perspective in ethics in nursing. So this discussion will be able to give you the idea, why do we need to study ethics? What is the importance of ethics in our work? Why did we have ethics, and what are the reasons based on history that led us to this ethics topic that we are discussing right now? I would like to disclose to you the references that I am using for this discussion. So we are primarily focused on that of healthcare ethics by Udan and colleagues. I am using the 3 other textbook as an additional reference. Okay, so I would encourage you to procure the first one, but then for the 3 ones, they are additional references. Now guys, why study ethics in nursing? Ethics is not new to us, no? For example, during our time, it was initially introduced in our elementary years as we are talking about GMRC. Now we are talking about good manners and right conduct. Then when we talk about ethics, basically we are learning what is right and what is wrong. Now, some of us are asking, why do we need to even study ethics? Okay, one reason there is that there's rapidly evolving and complex healthcare environment. Guys, gone are the days wherein you will just give medications to your patients. Your nursing care does not end when you were able to give medications to your patient. That's not nursing care alone. No, that's not nursing care alone. So there are differences already right now in the nursing care. Now, when I say rapidly evolving nursing care, dear students, for example, right now it's already the 21st century. Guys, the care that was rendered during the 20th century is already different on the care that is available right now on the 21st century. There is already difference on the care that is being given to our clientele. Now look at the keyword, rapidly evolving complex healthcare environment. When I say, guys, rapidly evolving, what do you think could be the reason for this? What do you think could be the reason for the rapid evolvement or rapid evolution of the medical care that we have? Can you give me probable reasons? What are the reasons why our healthcare is being revolving? Can you name some reasons, guys? On the chat box, could you throw some questions there or some answers on why our healthcare is rapidly evolving? Ideas,
Research,
please?
sir.
Research. Very good. That's one. Okay? Research. So in the past, guys, we used to say, I do this because my Lola nurse or my Lolo nurse told me to do this. But at present, our care class is already based on research. That's why later on you will be hearing the term, or even maybe in your fundamentals of nursing, you've encountered the term evidence-based practice. We have the term EBP, evidence-based practice, because care is already based on research. Somebody has mentioned technology. That was actually the answer that I was looking for. But then research is also an excellent one. So class technology. Take note that we oftentimes differentiate technology from science. When I say class science, it's basic knowledge. When I say technology, technology is usually the application of science. Technology is usually the application of science. Now, technology, when we say technology, what do you think? Is it all good or all bad? When I say technology, what's the thing that comes into your mind? Is technology good or bad? Sige na guys, your ideas are very much welcome. Is technology good or bad? Even on chat, throw it out.
Both, sir.
Diba? Okay, very good, no? So oftentimes, class, we say that technology is good. No, oftentimes we say that technology is good. But now I admire those who say that it's both, it's neutral, it depends. Why? What happens in the current setting, guys? What happens in the current setting? This is what our patients are commonly saying. Our nurses has no time already for the patients because they are too busy handling the computer. Oftentimes, they say that our nurses have no time to care for the patient at the bedside because they are too busy writing down things. They are too busy doing the computerization. They are too busy dealing with the automation. And then when the nurse class would enter in the room, in the past, we are usually taught that you need to talk to your patient, you need to converse to your patient, you need to give time to your patient. Right now, what happens, class, in the setting, when the nurse class will enter the room, the tendency is that the nurse will just touch the machine, and then after that would leave the patient. So what happens there? There's already lack of what we call your human touch. There is already a lack of what we call your human touch. One question in ethics also that we would like to answer is that, can robots replace nurses? Can robots replace nurses? What do you think, guys? Give me a yes or a no. Can
No,
robots?
sir.
Okay. Supposedly, no. Take note, I made an introductory line there. Supposedly, no. Why am I saying supposedly? Because if you will be observing the clinical setting, it would appear that it's as if the robot has more care compared to the nurse. That's the real picture that we have right now. But take note, we are not blaming the nurses. We will see later on what are the possible causes. Now, technological development is one, as you have mentioned. And then we also have difficult encounters. Picture it right now, for example, during the COVID-19 pandemic. Okay, let's say, for example, during the COVID-19 pandemic. Guys, we know that COVID-19 is infectious. We know that COVID-19 could easily be spread. Now, with your knowledge in fundamentals of nursing, when I am considering an infection like COVID-19, what's the ratio supposedly of nurse to patient? One nurse should be caring for how many COVID-19 patients? One nurse should be caring for how many COVID-19 patients? What do you think, guys? Sige na. Ilang pasyenteng may COVID-19 do you think ang kaya ng isang nurse? Ideas? Sige na, no right or wrong answers. Let me know your
Dalawa,
ideas.
sir.
2 to 3, sir.
Dalawa. Okay?
Isa lang
Two
dapat.
could be, one could be,
Depende
okay?
sa nurse.
Depende
Dalawa, sir.
depende sa.
Depende man sa nurse ko, sir.
Okay, class, actually that would actually depend on the acuity of the patient. When I say class acuity, for this time, just think of the severity of the patient's case. Think of the severity of the patient's case. Okay? Now, what do I mean by that? If the case is more severe, supposedly class, one nurse, one patient. These are your patients, class, which are admitted in the ICU setting. When I say ICU, okay, I hope that you remember that your ICU is your intensive care unit. So class, ideally 1:1, meaning one nurse should be taking care of one patient only. But what happens in our setting? Class, during the COVID-19, there is one nurse and then 5 critical patients. Okay? Now what happens? As much as the nurse wants to render the ideal care that the patient deserves, okay, as much as she would want to deliver the ideal care that patients deserve, they could not. Okay, imagine having 5 patients whereas you should only have 1. Okay, that's why, class, you have difficult encounters. And then the patient, class, or no, the nurse, I mean, is having the ethical dilemma. What would I do? Shall I complain about the 5 nurse? Shall I complain about the 5 patients that I am handling? Shall I complain about the very few nurses that are available? Or shall I take care of these patients as much as I can? Okay, so that's some of the reason why do we need to answer or why do we need to study ethics. Plus ethics kasi, although it would come into our mind that ethics is about doing good, but not all the time you have the choice to do good and do bad. Okay, it's not as simple as A or B. That's not how we deal with ethical issues. It's not as simple as, okay, let's give medication or not give medication. Okay, that's not how simple it is, no? So we have guidelines that we need to understand. But prior to that, let's try to capture the difficult ethical encounters experienced by the nurses in the clinical setting. So what are these difficult ethical encounters experienced by nurses in the clinical setting? Now, let's have oncological nurses. When I say class oncology, what do I mean by that? What disease processes are we talking there? Oncology. Sige na, when I say oncology, what disease process are we talking about there? Very good, we're dealing about cancer. Okay, we're dealing about cancer. Now, class, there is a struggle among cancer patients. 1, resuscitation state of the patient. Class, when I say resuscitation state, that's the time wherein you do your CPR. Okay, that's the time that you do extra life measures. We oftentimes say extraordinary life measures. Oh, what's the ethical problem there? Plus, there are patients who would want already to give up, but then the family would still want to be treated. The family would still want to fight. The family would still want to do the best for the patient. However, the patient would already want to give up. And then the patient would say, hindi ko na kaya. Okay? Gusto ko nang mag-let go. But then the family is saying, it's okay, give her medications, give her anything that could help her to live. That's one struggle that we encounter in the clinical setting. Now, futile treatment. What do we mean by futile treatment? There are cases, for example, of end-stage cancer wherein a lot of therapy is still given to the patient despite the possible fact that the prognosis is very poor. When I say class prognosis, prognosis refers to outcomes. So you will encounter instances, for example, cancer, end stage. You will know that the patient will die within 3 months or 6 months. And then here comes people who would say, there is still a possible treatment. Okay? You can do research. We have an experimental drug. So that's futile treatment. Now, look at not telling the truth. There will be instances, class, for example, where in the family, for example, the family would say, please do not tell my mother that she has cancer. Or they will say, please do not tell my lolo that she has cancer, or else he will feel sad. And the nurse will think, will I tell my patient or not? Will I tell my patient or not? In case, class, you will be torn on that ethical dilemma, okay, the answer, class, can be asked by this question. No? Class, who do you think is the best person to disclose the diagnosis to the patient? Will it be the nurse or the physician? Who is the best person to disclose the diagnosis of the patient? Is it the nurse or the physician?
Physician, sir.
Okay, very good. So class, you think that it is the physician's responsibility to disclose the diagnosis. Tandaan, it is the physician's responsibility to disclose the diagnosis. Okay? So class, as a nurse, my ethical advice for you is that do not tell a lie. Okay? For example, if the patient would ask, nurse, may cancer ako. Do not tell your patient, sir, wala ka yung cancer. Everything is normal. Everything is okay. Whereas you know that the result is not. Okay? Now, on that question that I posed earlier, who will be followed? Will it be the patient or the family members? Who do you think? Just given that simple situation, without other facts yet, who will be followed? Will it be the patient's wishes or the family's wishes? Sige guys, who do you think?
Patient concern.
Others?
Family, sir.
Others? Depends. Okay? So very good. I'll accept muna depends, but later on class, you will know that there should be an answer for that. So guys, in that case, actually, if you would look at the patient's Bill of Rights, it is the patient who has the right to decide. It is the patient who has the right to decide. But, I have a very big but there. If you are in the Filipino setting, class, you would notice that there is really a big cultural difference. Okay, there is really a big cultural difference as to how the decisions are being made. Now, dying with dignity. We are encountering patients wherein we know that they are dying. We know that these patients are already dying. Now, class, if your patients are dying, what's your role as a nurse? Okay, let them die, let them be, or do you still assist them towards dignified death? Let them be, or do we assist them towards dignified death?
Assist,
Okay,
sir.
class,
Yes, sir.
assist.
Sir.
Take note, assist. So guys, take note that your role as a nurse starts from womb to tomb. We oftentimes say we care for our patients from womb to tomb. What do we mean by womb? Even if our patient is a fetus, we care for them. Even if our patient is already dead, we care for them. Okay, that's part of your nursing responsibility. That includes class dignity. When I say class dying with dignity, if you know that someone class is dying, do not just say, hayaan mo na yan, mamamatay rin yan eh. Okay? We do not do it like that. We do not do it like that. Or for example, if you know that somebody is dying, you might be saying, oh, let him be. Don't mind the diaper. Anyway, he will die. No, that's not how we do it. Okay, you need to allow them to die with dignity. Now, conflicting values in pain management. Class, in cancer, your cancer class is what you refer to as metastasis. Okay, if you can recall in your anatomy, when I say metastasis, it means that the cancer has already spread. It means that the cancer has already spread from one site to the other. Okay, cancer has already spread to one site to the other. Now, what's the common site, class? What do you think is the most painful type of cancer? In what organ? In what organ do you think is the most painful cancer?
Brain.
Okay, very good on saying it's the bone cancer. Huh? It's bone cancer. Now, class, oftentimes the problem in chronic cancer or end-stage cancer is that your patient is already having severe pain. Your patient is already having severe pain. Now, if your patient students have severe pain, one of the management that we have for severe pain, one of the pharmacologic options that we have for severe pain is morphine sulfate. Morphine sulfate. Yes, you've heard of morphine, that drug that can cause addiction. But don't worry, in the hospital setting, the dose is controlled not to cause addiction. Now, class, morphine sulfate. The problem with morphine sulfate is that it has a side effect of respiratory depression. It has a side effect of respiratory depression. So what? You are made to choose which is more important. Is it the pain management or the respiratory depression? Okay, do not answer it now yet, but class, you are torn here between what is important, pain management or respiratory depression. So later on, you will know that there are fourfold questions to answer this problem. You will know that there are principles in ethics that could guide this problem. So you will encounter, for example, patients that even if the patient students is dying, and then if the patient is shouting because of pain, oftentimes we still give morphine because our goal is to assist the patient towards dignified and peaceful death. Okay, dignified and peaceful death. We don't want the patient to die shouting for pain. But then you need to be cautious not to give higher dose of morphine because too much increase in the dose of morphine could lead to respiratory depression. Okay? By which, when I say respiratory depression, that could still lead to death. That's one problem that we encounter in the hospital. Next, use of resources. Guys, when I talk about oncologic drugs, when I talk about drugs for, what do you call the therapy for cancer? Ideas? What do you call the therapy for
Chemotherapy, sir.
cancer? Okay, very good. You have your chemotherapy, no? So you have your chemotherapy. Guys, chemo is not for the poor, you know. I don't want to be biased there, but what I meant is that chemo is a very expensive treatment. Chemo is a very expensive treatment. Now, oftentimes nurses are torn. Does my patient really need these resources? Despite the fact that the prognosis of my patient is very poor. Does my patient really need to spend 50,000 pesos for the purpose of these medications, and we do not know what the effect will be? Then decision-making at the end of life care. Oftentimes, class, when your patient is already in the near end of life, diba, oftentimes these patients, class, would become unconscious. These patients has a tendency to become unconscious. Now, if they are unconscious, the question sets in. Who will decide? Who will decide for the care of these patients? Okay, so class, when it comes to decision-making, of course, it should be the patient. But once class, the patient is already unconscious, the next thing that you will have is the immediate family members. So you have the immediate family members. Unless, class, what document supersedes this? What document supersedes this?
Marriage, sir.
Marriage. Yes, class, in marriage, your immediate family would change. Instead of your mother, that would be your wife already or your spouse. What else? What else
Healthcare
allows
proxy.
other people to decide? Very good. Okay, it will be your healthcare proxy. Okay, it would be your healthcare proxy. So class, if you have listened in the introduction, your healthcare proxy actually allows for the appointment of a person that would decide for your healthcare in case you will become unconscious. So in the western side of the world, the US of A, your United Kingdom, a lot of people are already engaged in the use of healthcare proxy. There are already a lot of people engaged in the use of healthcare proxy. But here in our setting, no, medyo limited pa siya, but people are usually becoming more conscious na. Okay, people are usually becoming more conscious already about your healthcare proxy. So you need to be careful. If there is a healthcare proxy, regardless if there is a presence of family members, it is the healthcare proxy who will be deciding. Which goes without saying that even if the mother is present, if the best friend was appointed to be the healthcare proxy, it will be the best friend, guys, that will be followed when it comes to decision making. Okay? So those are the things that you need to consider, no? Siguro in the past, you never think that you might encounter those. Next, giving bad news. No? This is always the time wherein we do elbow to elbow, and then the nurses will be like, hey, you give the bad news to my patient. Okay? So you give the bad news. Everybody's pointing fingers if you, who will be giving the bad news to the patient. So again, I mentioned to you earlier that it is the physician's responsibility to deliver usually the bad news and then the diagnosis of the patient. As nurses, we are educated about diagnosis. We are educated about diagnosis. We are also educated about the prognosis of the patient. But class, we only have background knowledge. In order to make a diagnosis and then prognosis for your patient, it is the physician who has the license to do that. It is the physician who has the license to do that. One thing, class, that you need to uphold in your clinical setting is the principle of veracity. Okay? One thing, class, that you need to uphold in your setting is the principle of veracity, which means, class, the principle of truth telling. You need to be able to tell the truth to your patients. Okay? If you think that the truth will hurt them, class, assess further the situation. This is a very particular example in the clinical setting. For example, you have an old adult. The BP class is 200 over 100. Who can tell me what's the normal BP, guys? Who can tell me what's the normal BP?
120 over 80.
120, sir.
120
Okay?
over 80.
So class, your normal BP is less than 130 over 90. So you're correct for saying 120 over 80, no? But technically, strictly, it's less than 130 over 90. Now, here comes the patient. The BP is 200 over 100. As a nurse, what do you think will happen if you will tell the patient what his BP is? By the time that you will tell the patient what his BP is, what do you think will happen to the patient? Will he be relaxed or will he be more anxious?
Madugang iya
Kabahan
hypertension,
siya,
sir.
di ba?
Or
Kakabahan siya. Kakabahan siya. So you mentioned the patient will be nervous, the patient will be anxious, and somebody even mentioned, sir, tataas pa yung BP. No? The tendency is that the BP will be increased. So for that reason, class, we sometimes say, for example, the patient will ask, nurse, di pila BP ko? Okay, we sometimes say, sir, in a while, let's just recheck after 15 to 30 minutes. Okay, or sir, in a while, I will talk to the doctor muna. Okay, we do not right away, sir, 200 over 100. Pag ganun mo class kay patient, biglang pumuti ang mata, dead. Super increased BP, mas kinabahan sa ginawa. Okay, so it's a matter of approach to your patient. Okay, so those are still in ethics, no? Because class, in ethics, we always weigh the good and then the consequences. Okay, so class, let me rephrase that. Let me rephrase that by saying, we always weigh the benefits versus the risk. Okay, benefits versus the risk. That's always the principle that we follow. If there's more benefit to it, give the information. If there's more risk to it, don't. Okay, don't act on it right now. Now, class, emergency care providers are also frequently with stressful situations. They make decisions quickly but face barriers to ethical decision making. Now, what are the barriers? One, perception. What do I mean by perception? Plus, the way we view things, okay? The way we view circumstances is your perception. For example, okay, if I would look at it for Vincent, for example, this one is an emergency. But for me, this is not an emergency. So I will be chill. Never mind that patient, that's not an emergency. But then it might be an emergency. So if you would look at it, guys, your knowledge actually has a lot to do with ethics. Your knowledge actually has a lot to do with ethics. Okay? For example, you know that paracetamol, how many milligrams is paracetamol usually, guys? How many milligrams is paracetamol in our
100.
setting if you're taking the tablet? Yes?
500.
Yes, 500 milligrams.
100, sir.
500 milligrams. Now, here comes you. You're carrying out doctor's order. And then you've noticed that the doctor ordered 5,000 milligrams. If you are an intelligent nurse, you know that you need to question. You know that you need to ask, how come it's 5,000 milligrams that it's only usually 500 milligrams? So class, it's your perception of the situation that affects how we react to ethical decision making. Next, patient-related factors. Oftentimes as nurses, we learn the ideal, but then our patients are showing to us what is real. So for example, we will say, sir, in the clinical setting, based on fundamentals of nursing, the Foley catheter should be replaced every 3 days. Okay, Foley catheter should be replaced every 3 days. Now, what will I do as a nurse if my patient do not have the money to turn every 3 days? Okay, that's the real situation that we are encountering. Okay, that's the real situation that we are encountering. Now, input and output imbalance. So what do we mean by input and output imbalance? So, plus we can talk here about fluids. Okay, when it talks about med-surg care, this could refer about fluids. But in the general setting, there is an imbalance of the input and the output. So what do we mean by that? Not all that is taken in by the patient would actually go out as an output. Sometimes you do things for the patient. For example, you're turning your patients. Guys, what's the purpose of turning the patients? Why are we turning our patients side to side? What's the purpose of that? In your funda, what's the purpose of that? Sige na, what's the purpose? Yes?
Para hindi siya
Very
wound.
good. Wound.
Or hindi siya
Okay.
magka-stretch mark or
Hindi
stretch
siya sir
mark.
magkapila.
Say bed sores. Yes, the term there is.
Dead source.
Okay, so class, it prevents bed sores. No? It prevents bed sores. But oftentimes your patient will say, nakakapagod. I don't want to be turned because it's very tiring. Because your patients could not see what's the output. Okay, they could not see what's the output. And then plus, other than that, we also have the uncoordinated health system. What do I mean by uncoordinated health system? Now picture this situation. There is an ambulance arriving in my ER. Then the patient and the family members expect that the patient will be taken care of right away. Okay? They expect that right away there will be care that will be given for the patient. But class, that is not usually the scenario. Because what happens right now in reality is that by the time that the ambulance will reach the ER, there are still 5 ambulances ahead of them. Okay? And there will be instances wherein they waited inside the ambulance and then it would come out that there is no room available for them. Okay? I don't know if you experience this with your respective patients, but that's the common picture that you can see in the emergency room. Why is that happening? Because class, the health system is uncoordinated. Okay, the health system is uncoordinated. Supposedly, what do you think can be done to avoid that? What should the ambulance services do first before bringing the patient to the hospital? What should the ambulance services do first before bringing the
First
patient
aid,
to the
sir.
hospital?
Make sure
Mhm.
make sure sir nga ang hospital nga ato nanda is may available or hindi puno para ang patient nga nasa emergency nga condition is ano siya, ma-priority siya kung in case.
Okay. Yes, class. Basically, the answer there is coordinate. No? Coordinate. And your classmate was right that it needs to be called. Yeah, somebody has mentioned here on chat, call to make sure that there are available beds. Now, we are saying this because we are just dealing with the situation theoretically. But in the actual health setting, class, it is difficult. Okay? It is difficult in the actual health setting. Okay? That's one thing. That's one thing that we need to address. Okay? So, madali lang kasi sa atin kasi we are just looking at one aspect of the scenario. But that's why we are discussing that under ethics, because these are the real things that happens in our setting. Now, oftentimes kasi we think we are here to heal our patients. Yes, that's true. No argument to that. We are here to help our patients. But at the end of the day, it's not just giving medication. It's not just wiping the butt of your patients, but it's dealing with your patients in an ethical manner. And that involves a lot of factors, and that involves a lot of systems. Okay, so we will be continuing the discussion on this one.